Hello, my name is Carolyn.
My name is Anna Maria.
Today we're presenting DJ, a 75-year-old male diagnosed with Parkinson's disease. Parkinson's is a progressive neurological disorder that affects movement, coordination, and balance. Because of the loss of dopamine-producing cells in the brain, common symptoms include tremors, stiff muscles, slow movements, poor balance, and difficulty with fine motor tasks.
DJ reports concerns with falls and tripping, decreased independence with daily activities such as dressing, bathing, and preparing meals. He relies on his wife for support. He shared, "I hate the walker. It makes me look like an old man, and I fell in the shower last week. It wasn't my fault." He enjoys golfing and attending a men's group twice a week. Based on this, we expect occupational challenges with mobility, self-care, and safety, as well as possible limitations in leisure and social activities like golf and group participation.
The Berg Balance Scale was selected as a standardized assessment. This is a commonly used tool in occupational therapy to evaluate balance and fall risk, especially in older adults and individuals with Parkinson's disease. It includes 14 everyday tasks like standing, reaching, turning, and picking up something from the floor, with each task scored on a scale from 0 to 4. This assessment is a good fit for DJ because he has reported recent falls, difficulty mobility, and fear of falling. It is also practical for clinical use since it takes less than 30 minutes to complete and requires minimal equipment and does not require special certification. Using the Berg scale allows the occupational therapist to get an objective picture of DJ's balance, track progress over time, and plan safe and effective interventions to improve mobility and independence. First, we'll be doing sitting to standing. Please sit comfortably in the chair with your feet flat on the floor. And when you're ready, stand up. Try not to use your hands for support. Now I will have you stand for 2 minutes without holding on to anything if possible. Now, pick up the shoe which is in front of your feet. The Berg Balance Scale scores each task from 0 to 4 based on how safely and independently a person can complete it. A score of 0 means the person cannot complete the task or needs a lot of help, while a score of 4 means they can do it independently and safely. Scores in between reflect different levels of assistance and stability. All of the scores are added together for a total out of 56. Lower scores indicate a higher risk of falling, while higher scores indicate better balance. The scale provides a clear and objective way to measure balance and task progress over time. During the assessment, the client demonstrated varying levels of performance across balance tasks. For seating to standing, the client was able to stand without their hands and stabilize independently, earning a score of 4, which reflects a full independence and a good lower body strength and control. During standing unsupported, the client was able to maintain the position for 30 seconds without assistance, but then needed to reach for the wall for support. The performance indicates a decreased balance and endurance, resulting in a score of 2. When asked to pick up a shoe on the floor, from standing position. The client was able to complete the task but required assistance from a nearby chair for stability. This demonstrates some postural instability and results in a score of 3. Based on the client's performance across these tasks, the results suggest some balance limitations and potential increased risk to fall, indicating a need for interventions focused on improving balance, strength, and functional mobility.
For DJ, we selected a client interview combined with ADL, IADL observation as our non-standardized assessment. This approach allows the clinician to gather detailed, customized information about DJ's daily routines, meaningful activities, and participation challenges, which is essential for client-centered care in Parkinson's disease. This assessment is appropriate because it can be completed under 30 minutes, requires no special equipment, and provides immediate insight into real-life occupational performance. This assessment addresses 3 key aspects from the occupational therapy practice framework: areas of occupation, observing DJ's ability to complete self-care tasks such as dressing, bathing, and meal preparation, client factors, identifying motor deficits, postural instability, and functional limitations that affect independence, and performance skills, evaluating how DJ's coordination, balance, and fine motor skills impact participation in meaningful activities like golf and attending his men's group. This non-standardized assessment works with the standardized assessment to give a full picture of DJ's strengths, challenges, and priorities, helping guide safe and meaningful interventions. Hi, so I'm going to ask you a question for this first assessment. Can you tell me which daily activities are most important to you right now?
I want to get dressed on my own and move safely around the house and continue golfing and attending my men's group twice a week.
Thank you for sharing that. So for this next assessment, it's going to be a dressing observation. Please put on that sweater as you normally would. So for this last assessment, it's going to be a functional movement observation. Please carry this book to the other end of the table. Okay. For the non-standardized assessment, for the client interview, the client is highly engaged and determined, demonstrating clear priorities for independence in daily activities and leisure. For the upper body dressing, the client requires assistance due to decreased coordination and upper extremity weakness. as he took increased time and used both his hands and head to put on the sweater. For functional movement, the client also requires assistance as he demonstrated slow movement and mild instability while carrying the object, indicating decreased safety during mobility.